It is 11:30 a.m. at the health department, and you need to help your colleague with meal distribution. You check the workstation chart for any nutritional needs of your patients and then proceed to hand hygiene. The following situations require soap and water hand washing. Before coming into contact with users and their surroundings, and prior to administering medication. Before and after physical contact with users, wearing gloves, and handling food. After physical contact with user surroundings, handling soiled linen or clothing, waste, or dirty dishes. Potential contact with biological fluids such as washrooms, providing personal care to users, or any type of potential contamination. Clean, short, unpolished fingernails with no extensions are preferable. Jewels should not be worn. A hand check is essential to detect any cuts or scrapes which could lead to infections. Wearing gloves protects the PSW from potential contamination from biological fluids. The PSW takes paper towels from the dispenser to prevent any hand contamination from handling after hand hygiene. She turns on the tap standing away from the sink to prevent splashing and contamination of her uniform. She regulates the temperature as this is less damaging to the skin than hot water. She wets her hands, fingers pointing down so the water flows from the least contaminated area, the wrists, to the most contaminated, the fingers. She applies a small amount of soap. The PSW scrubs her hands, rubbing the palms, backs, and wrists with circular motions for 15 to 30 seconds. She makes sure to thoroughly clean between her fingers for 15 to 30 seconds. She uses her opposite hand to remove microorganisms from her thumbs with circular motion for 15 to 30 seconds. She cleans her fingertips and nails by rubbing against the opposite hand. She can use a brush to scrub thoroughly under the fingernails if deemed necessary. The PSW scrubs her wrists to complete the procedure. She then rinses her hands, fingers pointing down, keeping the elbows above the wrists to make sure the water flows from the wrists down to the fingernails. The PSW shuts off the water using the device, or if necessary, uses a paper towel to turn off the taps, thus preventing any contamination. She then puts the towel in the wastebasket and dries her hands with new towels. Now that her hands are clean, it is necessary to dry them from the fingertips towards the wrists. Mrs. Dion has lung cancer. Her chemotherapy treatment is ending, and she has been put in isolation due to immunodeficiency. You need to assist Mrs. Dion with her personal hygiene. Therefore, you wash your hands with hydroalcoholic solution in order to limit the potential transmission of pathogens to a minimum. Antiseptic hand washing is prescribed prior to providing personal care to users or entering into contact with a user with immunodeficiency, and whenever soap and water hand washing is not possible. The PSW applies a small amount of hydroalcoholic solution to the palm of one hand, dips her fingernails, and then applies the solution to both hands. She then scrubs the palms and backs of her hands and then her wrists with circular motions. She crosses the fingers to scrub the interfinger areas. She uses the opposite hand to remove microorganisms from the thumbs. Then she uses circular motions around each opposite thumb. Waiting for the solution to fully evaporate is essential, making sure her hands are completely dry before moving on to other duties.